Now, infection does not leave the spine. So, infections are common in spine. Okay. So, infections are common in spine. And one infection which commonly affects the spine is tuberculosis. Tuberculosis of spine. Okay, tuberculosis of spine. Okay, few points about tuberculosis of spine. See, this is the vertebra. This is the vertebra. You get a disc here called as the intervertebral disc. You get a ligament here called as anterior longitudinal ligament, posterior longitudinal ligament, and you get the spinous processes posteriorly. Normally, when TB spine occurs, TB spine commonly affects the thoracolumbar junction. Thoracolumbar junction. Thoracolumbar region is the region which is commonly affected by TB. When TB occurs, the infection is seen in the paradiscal portion. The infection is seen in the paradiscal portion. So, paradiscal TB is the common type. Paradiscal TB is the common type. So, what are the other types of TB spine? Then infection can be seen in the center of the spine. It can be seen in the anterior aspect of the spine, or it can be seen in the posterior aspect of the spine. So, they are further classified into anterior type, central type, and posterior type. Anterior type, central type, and posterior type. Of this, posterior type is the rare type. Posterior type is a rare type. So, most common type is paradiscal variety. Most common type is paradiscal variety. Now, just imagine there is one important structure which is running here. Can anyone tell me what is the important structure that is running behind the vertebral bodies? What is this one? This is spinal cord. This is spinal cord. Now, whenever an infection occurs, this infection can spread posteriorly. This infection can spread posteriorly and can affect and can compress the spinal cord. When spinal cord gets compressed, then it results in a condition called as Pott's paraplegia. Then it results in a condition called as Pott's paraplegia. What is called as paraplegia? Inability or weakness or paralysis of both lower limbs is called as paraplegia. Paralysis of both lower limb is called as paraplegia. Paralysis of both lower limb is called as paraplegia. If all the four limbs are paralyzed, what is that called as? If all the four limbs are paralyzed, that is called as quadriplegia. If only two limbs, that is the lower limbs are paralyzed, then it is called as paraplegia. That is called as paraplegia. Okay. So whenever Pott's paraplegia occurs, it requires surgery. It requires surgery to correct it. It requires surgery to correct it. Whenever you diagnose Pott's spine, TB spine, you can treat the patient with ATT. ATT is anti-tubercular drugs. Anti-tubercular drugs. You can use ATT to treat the drug, to treat the TB, and you can give rest for the patient by applying braces. Okay, by applying braces. This is called as middle path regimen. This is called as middle path regimen. So you try to treat the TB spine by giving only drugs and braces, no surgery. So such a regimen is called as middle path regimen. Such a regimen is called as middle path regimen. Such a regimen is called as middle path regimen. Okay. So this is about the TB spine. Tuberculosis of hip joint. Tuberculosis of hip joint. Okay, whenever TB affects a hip joint, it goes in 4 stages. Stage 1 is called a stage of synovitis. Stage 1 is called a stage of synovitis. Stage 2 is called a stage of early arthritis. Stage of early arthritis. Stage 3 is called a stage of late arthritis, and stage 4 is where you get wandering acetabulum. Wandering acetabulum. And stage 5 is ankylosis. Stage 5 is ankylosis. Stage 5 is ankylosis. So in synovitis, the limb is in the attitude of Faber, and the limb appears lengthened. And the limb appears lengthened. In all the others, the limb will be in the state of Faber attitude. And in these cases, the limb appears shortened. The limb appears shortened. Once if you diagnose that the patient has got TB hip, you have to treat him with antibiotics like antitubercular drugs, and if needed, if the stage of disease is late, you can offer him arthroplasty also. You can offer him arthroplasty. You can offer him arthroplasty. So this is about the TB hip.